Sexually transmitted infections are on the rise across Scotland. Sexually transmitted infections are infections which can be passed on during sexual activity. They can affect anyone who is sexually active of any age, sex, gender, sexual orientation, and ethnicity. Most STIs are easily treated, but they can cause complications and lead to health problems if left untreated. The only way to know if you have an STI is to have a test. The most common STIs are chlamydia, gonorrhea, syphilis, genital herpes, genital warts. Bloodborne viruses such as HIV or hepatitis B are often spread by sexual activity. It can be difficult to know if you have an STI without a test, as some people don't experience symptoms. However, some common symptoms can include unusual discharge from your vagina, penis, or anus, itching or stinging feeling in the genital area, burning sensation when peeing, bleeding between periods and after sex, ulcers or blisters, pelvic pain, pain during sex. Sexual health services in Scotland are free. Anyone can attend, regardless of who you are, your immigration status, or whether you have registered with a GP yet. You can find a list of sexual health services on NHS Inform website. You can book an STI test online or by contacting your local sexual health service. Services available may vary across Scotland. You can also get tested at your GP practice if you are registered. The test is easy. It may include a urine specimen, a swab, cotton wool bud, or a blood specimen. The nurse or doctor may ask you some direct questions about your sexual activity. You may feel embarrassed, but it is important that you answer honestly so they can take the correct tests and ensure you get the correct treatment if required. They will treat you with respect and without judgment. All services are confidential. They will not share information about you to your friends, family, GP, or employer. If there is a concern that you or other people are at risk of harm, they will discuss this with you. If you need it, treatment is free and effective. If you have symptoms of an STI, you've been told that someone you have had sexual activity with has an STI, you've had unprotected sex with a new person, if you are in a new sexually active relationship. Using condoms correctly for vaginal, oral, and anal sex is the most effective way to prevent STIs. If you're having anal sex, it's important to also use water-based or silicone-based lubricant. Anyone can get condoms for free in Scotland, even if you're under 16. Free condoms and lubricant are available from sexual health clinics, GP practices, and pharmacies. HIV PrEP is a medicine that reduces your risk of exposure to HIV if taken as directed. The tablets can be taken every day or can be taken in the days before and after sex, depending on what type of sex you have and how often. Contact your local sexual health clinic for more information. If you think you have been exposed to HIV, you can reduce your risk of becoming infected by taking post-exposure prophylaxis, or PEPC. This is a short course of medication. PEPC can be taken up to 72 hours, 3 days, after sexual exposure, but it is more likely to be effective within 24 hours, one day, so it's important to act very quickly. Pepsi is available from your local sexual health services or out of hours, evenings and weekends, at an emergency department. You can find details of your local sexual health services from NHS Inform.